Hey guys, I hope you are all doing fantastic this afternoon. So today I just want to take a quick minute and talk about unexplained low back pain. There's actually quite a few people out there with this, and a lot of times they have been to chiropractors in the past and their lower back never really got better, or they've been to physical therapy and it was just one of those things that couldn't be worked out and they still had a significant amount of pain. One of the things that can cause this unexplained low back pain, well, let me first clarify. By me saying unexplained low back pain, I mean that you haven't had a traumatic instance or an identifiable instance as to where or when it started. So, one instance of unexplained low back pain, and this is actually very typical of something that we would see in our office, which is why we use the thermal scanners, the posture camera, and the EMG scans. But one of the things that can do it is actually not having enough curve in your neck. So your head comes forward, that forward head posture. What will actually happen is your low back will compensate to keep the center of gravity going through your pelvis the best it can. Those ones, a lot of times you correct the problem in the neck and problem goes away. A second also very common situation that we run into with unexplained low back pain is that a person has a short leg. And by saying a short leg, I mean that they're born with a short leg. So it's normal as part of your body's actual righting reflex to keep your eyes level on the horizon, to actually shift your spine and have you compensate so your eyes remain level. Pretty darn cool. So after you go through and you receive treatment for that, your legs should be even. When they don't even out after that, something that we look at and the kinetisense system that we use actually picks this up well, or I should say as well, is after spinal correction, your leg is still shorter than the other one. It's actually also super common after hip and knee replacements. And we as chiropractors know that if your leg is 1/4 of an inch shorter than the other side, you'll actually never have what would be referred to as spinal stability in the region. So what we would recommend in that instance is a heel lift. They're actually pretty darn cheap. You do need to know what height you need, so you do need to be evaluated for this. And you should gradually see that improve over time. So if you guys have any questions or comments, feel free, shoot us over a message, and we will get back to you as soon as we can. And we hope you get outside and enjoy the sun today. See ya.